So I'm Adam Cheifetz from Beth Deaconess Medical Center in Boston, Massachusetts. I just gave a talk on complementary and alternative medication use in inflammatory bowel disease. I think some of the big take-home points are that you really need to ask your patients about this, that half your patients with IBD are taking complementary alternative medications, and about half of the patients are not going to be forthcoming. Part of every patient interview, when I ask them about what medications they are taking, not only do I ask them how much they're taking, give them permission to tell me, I always ask about other medications. Are you taking anything over the counter? Then I'll usually also say, are you taking anything under the counter? And it is amazing what the patients will actually tell you. And again, it's important to be open and frank about the discussion. Go over, yes, the potential benefits, and of course, in some of them, the potential risks of the various complementary or alternative therapies. And of course, that none of these are regulated, and really no one knows exactly what's in each of the therapies. I would say take-home points on the different medications, to be honest, would be in two of the slides. There is very little evidence on the benefits of complementary therapies. The studies are small, they're not typically followed up, they typically lack from placebo control. The one most people ask about is marijuana or medical cannabis. There really isn't good data that it's effective for treating the inflammation in Crohn's disease, and there are significant side effects, but again, you really need to ask about it. And this is one of those things that patients will definitely ask you about regardless. Curcumin, I think there is a bit of data for both for induction and maintenance in mild to moderate UC failing 5-ASA. VSL number 3, particularly for prevention of recurrent pouchitis, maybe a little bit of evidence for Crohn's, for ulcerative colitis, mild ulcerative colitis. And again, anytime you discuss these and go over these, oftentimes you use these as a bargaining tool. Okay, let's try this, but if in 2 weeks you're not better, here's the next steps we're going to do.